are a people business. The most valued thing that we do is we bring people into home and community settings to help our communities. At Visiting Nurse Association Health Group, home health aides play a critical role.
They are truly the backbone of the service. They do so much for patients and families that I don't think they can be recognized enough.
They get to spend more time with the patient and the family than any other profession that goes into the house.
We would not be able to do our jobs without them. They're the first things that the patients and families ask for when we go in to talk about hospice services and philosophy.
Home health aides work with nurses and therapists and our whole team to improve the lives of patients and families. The home health aides really have a very big challenge, and they bring incredible skill and dedication and a lot of love and compassion to their work.
My presence in the lives of their family member that needs care puts them at ease and makes it easier for them to go on. It's very important to be there in the moment with the person that you're visiting.
Sometimes they sad, so you have to be there for them like a friend.
We've often been told they're like angels of mercy. They come in and they take over and do the personal care.
I get to read what our patients and families that receive our care think about the services that we provide. And at the core of many of those letters are the experiences people have with their home health aide.
I think it's all about their attitude, and that comes shining through on each and every case.
I have a beautiful letter. The patient's spouse said that every day it's a dose of sunshine when she comes into the home.
When I receive positive feedback from the patient or the family members, it provides me with the knowledge that I have done well. I have provided their loved one with the best care I can offer them.
It's feel good for me because I help people that is really that situation. So I said, okay, so looks like I accomplished something that what I promised to my grandma.
So when we hear these things from these patients and the patient's family, it makes everybody feel good. It makes you want to come to work the next day and do the same thing.
All my patients is like my own family from my heart. For me, is as long they are comfortable, I'm happy with it.
I think it's not hard when you do that from your heart, when you love to doing, you're feeling great when you're doing.
The one thing that comes to mind with Josephine and a patient and family is at the Jewish home where she works, and she took care of a family member for a very brief period of time, and that patient died. But then the daughter requested that she take care of her father. So she took care of him and for a very long time, and the daughter's child was getting married. Now, Josephine works 2 full-time jobs and has children of her own, and on her day off, she came into the Jewish home and showered or bed bathed this patient, got him dressed in his suit, and she accompanied him to the wedding so that the daughter could focus on her child, and Josephine sat with this man, and so that he could attend his grandchild's wedding. And I just thought that was so wonderful. She didn't ask for anything else in return. She just did this out of the goodness of her heart.
And the father is really quiet because even though he walked in the aisle, the dad don't want to walk in the aisle without me. So, but I cannot walk with him in the aisle because that is only with the dad. So I just have to go all the way to the side and looking at him and said, I am here, walking with you. So the dad is really following what I am saying to the father. I help her because she is. She really appreciates what I did to her dad, and I love his dad like my own grandpa. So the family is really appreciated. It's not only the daughters, everybody's really appreciated until now in the Jewish home. When they saw me, they are always asking, where is Josephine? So it's more, for me, I work more hard because I hear that what I'm doing I said, oh, thank you so much that you really appreciate what I am doing.
I do have a case where it involves a husband and a wife who's been married about 60 years. And within those 60 years, the wife developed multiple sclerosis. And the husband has been providing her care for about the last 40 years. So it is definitely difficult for him to see his wife decline with this illness. But I do find that visiting them helps him get through his day and the care that he provides his wife. So when I arrive, we discuss the wife's situation for that day, because every day brings a new development. And we take a moment to discuss what he may be experiencing or wanting to talk about that day. And usually he likes to talk about finances. And I, knowing finances, we have a great time discussing it. We also teach each other how to use Windows 10, because that's new to him, it's new to me. We teach each other how to use the iPhone. We tell each other jokes. We provide that comfort level so that we both can continue that day with the wife's care.
She comes in with a smile. She speaks to the husband. She speaks to the patient. She gets the updates from the prior visit. She communicates and reports with her nurse to put him at ease and just reduce his anxieties that, someone else is out there too, and we're all working together to give you that best care that we can give you. She puts on easy listening music, so the atmosphere is calm and relaxing. Dims the lights just enough so that she can still give safe care, but create that relaxing ambience for the patient. And water temperature is perfect. She's covering the patient as she's giving personal care to provide privacy. She's giving back rubs and massage during the care provision, and it's just so good. And the thing I think that impressed me most with such a patient, that high level of debility, unable to care for any part of her life herself. Elizabeth gave her some independence at the end of the visit and said, what kind of clothing do you want to wear today, and just sort of gave her options and gave her a choice, and it really touched me.
I work with somebody. When I'm walking to that door, I see somebody crying, a man. And then when I walk to the room, I see a 100-year-old man, lay down, and then they wanna be together. She don't wanna die, he don't want she die, and they cry. Every day when I went there, they crying. And then in that moment, you have to be home health aide, and then you have to be like friend in the middle. You have to calm the son down, the family, you have to calm them down, and the patient too.
We get to receive positive feedbacks from our patient virtually on all the home health aides we have. But the easiest one that came to my mind is that of Rosanna, who was seeing a hospice patient. So apparently I definitely know, because I speak with the family often, and they tell me how great Rosanna was. But after the patient passed on, the family actually took the time to write a letter in a beautiful piece of paper and send it to the office and detailed everything Rosanna did, which simply means the whole world to everybody. So it made Rosanna feel great. It made myself feel great, and I'm sure it made the whole organization feel great that at least that's the objective of being in the house was achieved, because that's the main purpose of an hospice program. So, and I must say that is not just a one-off thing. We get the letters all the time. Sometimes it might not be in a form of letter, it could be phone calls, but we get positive feedbacks all the time.
This is an under-recognized service that we provide quite often. but when someone is very, very sick, and I hear it every day, the person they call for the most is the home health aide. So I'd love to say to all of our home health aides at VNA Health Group, thank you for everything you do each and every day. You are very much appreciated by the nurses, by the whole entire team. We can't thank you enough, and we're so grateful to work with you each and every day.
We are so fortunate to have each and every one of them working with us, and we could not do this job without them. The care that they provide to our patients and our families is above and beyond.
And I just want to say thank you, congratulations on making such a difference, and that I look forward to working with you on our future and finding ways to grow and learn in your careers and make more and more of an impact for the people that we serve. Thank you so much.